Hello, I am Dr. Daoshing Ni, Department Chair for the Doctorate Degree Program at Yosan University of Traditional Chinese Medicine.
And I'm James Skoien, Senior Faculty for the Doctorate Degree Program at Yosan University.
Please join us as we explore acupuncture points and their clinical applications. Welcome. Today we're going to be looking into several points, basically lung 1 to lung 6. We're going to start with the first point, lung 1, 中府. 中府means the residence of the middle or the central treasury. And there is an interesting story about this point because when you look at a lot of the classics, you will see that many of these lung points very closely tied to the spleen earth element. So as part of this name, 中府, it also really to remind us that very much so the lung gather the qi and permeates and work and mix with spleen earth, that it is really in some ways a point that directly connect to the spleen zang organ. And so this name is a very interesting name, not just denoting the importance of that somewhat middle and center of the body, the breathing organ, but also looking at spleen, the connection with the spleen organ.
Very good. And just to expound on that, there is also a clear relationship in its location to the spleen channel because lung 1 is directly superior to spleen 20 on the channel. And it is also considered an intersection point for the lung and the spleen channel. In terms of its location, I try to locate this one clinically by visually recognizing the junction of the lateral end of the clavicle and the anterior deltoid muscle. These are easy to visualize. I then palpate directly inferior to this junction to find lung 2, palpating further inferiorly to recognize the upper border of the lateral pectoralis major, and finding then lung 1 in this first intercostal space. Do you want to say something about the actions of the points, Dao?
Well, we will, of course, get to the lung 2 point in a moment. This is how do we, is a very, I would imagine would be a very tender point. When we locating it, how much pressure do you think we should press on this point?
Well, in locating this, I put a mild to moderate amount of pressure on the point, trying to distinguish tenderness, but not excessively through a painful spot. Okay.
Yeah, and I also know this is a arm point of the lung channel. As we talked about earlier, it is an intersecting point of the lung in the spleen channel. Therefore, I believe that this point is not only a very good point to regulate the qi function of the lung channel, but it also has very important element in the sense of tonification of the spleen organ. So as we know in the actions of this point, this point is mainly used to activate the lung function of how it dominates qi and controlling respirations. And it's a very good point to disperse any kind of qi stagnation in the upper jiao, in the lung area, especially.
Yes, that's why it's used to treat dyspnea, shortness of breath, wheezing, acute and chronic recurrent cases of asthma. It's also specific for chest pain, especially as it reaches the lateral aspect of the outside part of the chest, and especially when the chest pain is related to a lung disharmony. Do you use this point for other lung-specific symptoms like cough or relating to other lung disharmonies, even conditions of the nose?
Well, I do use lung 1 point quite a bit in a younger population. I do find that as one ages, when they lose a lot of the lung muscles, especially when you have an older man, and when they're very emaciated, very skinning, I tend to be more afraid of needling that point too deeply. So I tend to try not to use that point, especially in those circumstances. But nevertheless, I do use it to tonify lung qi when a lung qi weakness is at hand.
And how about in cases of acute asthma?
The acute asthma, I tend to go to the C cleft point, which we're going to talk about it today in lung 6. I think I would use that point more. And also depends on the cause of asthma. If, as you know, if there is a very strong lung heat situation, I think the lung 5 is definitely a choice point.
I understand.
Compared to lung 1. I see lung 1, since it's a moot point and it directly regulates the lung, I see it as, to me, a more a tonification point for me personally. So I can see that we also use this in moxibustion, and I would say that the needling methodology is really obliquely, laterally, and depends on each individual. But to be on the safe side, personally, I would use 0.3 to 0.5 cun. There are some textbooks that talk about 0.5 to 0.7 cun. I rarely go beyond 0.5 cun, just to prevent any kind of possibility of a pneumothorax.
I understand. There's one exception where I'll go deeper, but of course I'm directing it differently. I'm directing it into the deltoid muscle from the point itself when I'm treating problems of the lung channel, such as pain in the thumb. I found the point to be quite useful in relieving thumb pain, which is of course related to the lung trajectory as the last or most distal part of the lung channel. But in that case, I'll needle lung 1 from the point which we defined above to the deltoid muscle into the, so to speak, the lung channel as it traverses into the upper extremity.
Oh, that's wonderful. You know, I haven't heard too much about how that has been used for the joint pain, but I do know that there is this point has been used for both just a general qi deficiency when you have both lung and spleen qi deficiency with poor appetite and diarrhea symptoms involved. I've seen that used clinically.
Just for one more question I have on you, when I'm thinking of your depth, do you try to achieve the qi sensation on this point? And if so, how do you do it? Is there a specific method you prefer to use?
Well, I try to avoid thrusting always. So a lot of times I get de qi really early and really quickly at about 0.3 to 0.5 cun. I think at 0.3 cun, I already can get de qi from the patient without much manipulation. Again, I am more conservative in treating patients in the lung area just because of a lot of precaution we have learned clinically of prevention of pneumothorax. And you also know that pneumothorax can occur even when you don't actually puncture the lung. Collapsal lung can occur when when the patient's weak, sensitive. So I usually take that into consideration also when I needle this point. But don't let me stop you using from this point, because I do use this point quite a bit. Extensively. I'm not shy of using this point. I'm just very careful when I use this point.
Of course. Very good.
Well, yeah, good. Thank you. And let's go to lung 2. Lung 2 is Yunmen. Yun means cloud, and Men means gate. And here, cloud really means the qi of the meridian. And while the gate means the door where the meridian qi leaves from. So a lot of time we say that cloud is kind of like the qi of heaven, and qi of heaven connects to the lung. So this is the point of hand tying lung meridian, and lung qi is like the cloud, And this point is like the gate, where the lung qi sends out from the organ, sends out from the trunk, and sending this energy into the upper extremity. That's why this name of Yunmen called it the gate of cloud. And that's at least what we have gotten this from the Su Wen, one of the chapters in Su Wen.
As far as its location, I'm finding this point directly at that lateral end of the clavicle and at the junction of that lateral end and the anterior deltoid muscle. So I'm visualizing and palpating it and then locating the point directly underneath that junction, looking for and palpating the deeper anatomy for the coracoid process and the pectoralis minor muscle.
Yeah, I agree. And this is very similar to the lung one, very similar location, straight up and down here. And I would use very similarly as the lung one function, except personally, I use lung one as more of a tonification point, while lung two, I use it for more purging and more sedation point. And if you look at in the textbook, and especially some of the ancient texts, the action of this point is to disperse lung, stop cough, dissolve phlegm, and dissipate knots. And interesting enough, since this is kind of like the gate of the cloud, it gate to the four extremity, it actually can use to purge heat of the four extremities. So for feverish conditions where the extremities has a lot of heat, we can also use it in those kind of situations.
One of the indications you have also talked about to me before is that this is used as a local point by shoulder pain with limited mobility. And I've used it more for this channel indications than for lung-specific conditions, for problems related to pectoralis minor and mobility.
And, as sometimes I also use, I just recently have a case where a patient just had a pancreatic tumor removed. And she had a diaphragmatic infarct, and she has a lot of neuropathy and neuralgia that goes up to her left shoulder. And I have used this lung 2 point on her and have found it effective in helping this kind of qi reversal type of pain. And that was pretty helpful. So I thought I want to share with you.
That's very interesting. Very interesting. Could you talk about some of the other point combinations that you might use with lung 2?
Well, let me ask you, what kind of combination do you usually use? Do you combine with other points? I have one, I can say, for the extremity fever. When you have feverish extremities, I would combine with large intestine 15, or bladder 40, or gallbladder 39. This is actually very classic. This is from the Su Wen chapter 61 for the four extremity fevers.
And the needling technique, do you also needle it perpendicularly or oblique, laterally?
Yeah, I do it laterally. I think that's safe. I try not to do it perpendicularly. If I do, regardless, I usually stay with about 0.3 to 0.5 trin. There's some books that will tell you can needle 0.5 to 0.8 trin. I just like to err on the conservative side, so I usually do a 0.3 to 0.5 trin. And by the way, we can maxa on this point especially for a situation of a cold condition.
Are you ready to talk about lung 3?
Absolutely. Lung 3 is Tianhu. This is another palace, another resident. Is called, if you translate directly, is the heavenly resident, celestial storehouse, or celestial mansion. Basically, this is the first point where the lung qi now have exited from the body, the trunk of a body, now is going into the upper arm region. And this is the first stop point of the point that's going downward, sending the energy of the lung channel downward throughout the rest of the lung channel. So it's a very important, decisive point. So that's why we call this the heavenly resident.
I see. Well, I'm locating this more in the contemporary way by looking at the biceps brachii muscle and staying on the lateral side of it and subdividing the upper arm into units of 3. If we take the anterior axillary fold and the cubital crease at the elbow as 9 sun, that I'm finding 3 sun distal to the lower border of the anterior axillary fold, and trying to needle this point perpendicularly anterior to the humerus, or at least in that direction. So that's where I'm defining the lung meridian line at that level. Looking into when I'm needling, actually achieving or arriving into a muscle like the brachialis muscle below or deep to the biceps brachii.
That's wonderful. And as action goes, this point has been used to improve the flow of energy between the head, the trunk, to the arm, as well as to the rest of the body. We have known this point can be used for goiter, swelling in the neck. It can be used for lung-related spirit disharmony, emotional disharmony, such as sadness and depressions. It can be also used for stress-induced asthma, poor memory, mental fog, melancholy, and even delirium talk. I think it can also be used for that. And there is also a mention that you can also use this point for liver invading the lung pathologies. Generally, though, I think we can use this for a lot of heat-related issue, whether it's excess type or a deficient yin with a heat rising. And that's at least overview of what the action of this point is.
If I can add just one other indication for the use of treating the channel. Again, I'm differentiating very clearly between organ pattern treatment or differentiation treatment and channel. I use the image of the upper arm basically representing the spinal column, and at the level of lung 3, also getting between lung 3 and lung 4, is roughly around the zone, so to speak, for lumbar 3. Because the lung channel has the ability to treat bladder channel problems, I use this point sometimes for low back pain at the level of L3. So that's a channel-specific energetic rather than an organ-specific function.
Do you think that's, do you see that as a microsystem type of treatment? Are you some people treat the arm and the hands, as you know, there are definite lower back pain points on the hand. Are you seeing the use in that light?
The discussion might take us a little too far away, but briefly, I think we can start with a couple of models, one being the model presented for the second metacarpal bone, or expanding it to long bones throughout the body, where we can see representative bodily figures or homunculi, including structures like the spine. So we could take the upper extremity and make an argument that with one image, rather than going through all the possible ones, that we do have a possible image of the shoulder representing the sacrum and lumbar 5 region, and the elbow representing lumbar 2 region, just staying at that upper arm. Then the middle of the upper arm, or between lung 3 and lung 4 area, would be the area around lumbar 3. So I'll refer to it as a reflex zone or an image right now, and maybe at another time we can discuss that thoroughly.
That's excellent. And the way I would needle this point is most of the time, since it's on the margin of the biceps brachii, usually the needling is perpendicular about 0.5 to 1 chun here, and we can also use the moxa in more cold conditions. All right, let's get into lung 4, Xiabai. Xiabai is a very interesting point. Personally, at the very beginning when I was studying acupuncture, I had a hard time understand this word Xia, because Xia means hero in Chinese. And why would you need a hero in this point? And then the second word means Bai means white. Now, white, it's understandable because white is the corresponding color of the lung organ, so I can see why such a word is there. And also sometimes bicep area, there's some skin difference between white and dark skin, so I can see why that color is there. So I went into the text and I really looked at it closely, and I realized, this actually have two meanings. Xia, the first meaning can mean force. While white is the corresponding color of the lung organ, this really means that the force of lung energy is exhibited through this point, or the biceps. And the second meaning is transformation, where that this point is where qi and blood and other materials are transformed, where the clear and the turbid separates. And this point takes the cloud that we were looking at lung 2, transmitted from lung 3, and transform into raindrop downward to the ground. I thought that was very poetic. And that is actually a description from the ancient text of the naming of this point. And so...
Well, I think mainly with that very interesting description, which I, of course, did not know of, I might consider using this point more. No, I haven't understood the meaning of the name up to this point. Okay, so in terms of the practical location of this point, it's one cun below the lung 3 point, which makes it 5 cun above the elbow, and so one would divide the 9 cun measurement again, as we did with lung 3, to come to the proportional measurement of 5 cun above the elbow. Again, in terms of its use, now, I would like you, if you don't mind, to expound on the actions, as it's not been a point that I've focused on much over the years.
Yeah, before we get into that, I just want to make sure our audience know to locate this point, it's pretty obvious. You want to either do a sitting or in a supine position. And sometimes if you lying on the stomach, and if you turn the arms laterally, a lot of time you not be able to get to this point accurately. But yes, the action of this point is very interesting. It's used to disperse lung qi, to regulate lung qi, and to open up the chest. So I'm thinking that when you talk about disperse and regulate, I'm thinking about disperse in the sense of the lung organ, and regulate in the sense of the lung channel. That's how I see it in these two descriptions. So open up, clear up the chest, clear up and descends lung turbidity. So it's very good for phlegm and cough. Interesting enough, also used as a point to moisten the spleen for any kind of spleen dampness, actually. Eliminate dampness, phlegm, congestions and also harmonize the stomach. That's the action that I see for this point.
Again, this is a point that I haven't used, but what you have for indications of cough and shortness of breath, chest fullness, dry vomiting and restlessness, heart pain, palpitations, sore throat. Those are lung-specific symptoms as well, and as well as the skin condition of vitiligo or vitiligo, or an urticaria. So besides treating those pathologies or symptoms related to pathology, organs or pathogenic factors affecting the skin, you also can use the point as a local point, as a point for pain on the medial aspect of the upper arm.
And as I was going through the research of this point, it was what was very interesting to me was the ability for this point to treat vitiligo as well as urticaria for these two skin conditions. And so I went back and looked at some of the textbooks, and then I found that it was actually has been presented in two separate classics for the first one used for vitiligo. Usually they combine this point with tianhu. So basically, lung 3 and lung 4, you use it together, okay? And then for the urticaria, you can use it with a combination of Bai Hui, which is your Du 20, Feng Fu, which is your Du 16, Treats is your large intestine 11, and stomach 36, and Yin Yin Qian spleen 9, and then San Yin Jiao spleen 6 combination. So I saw that in the experiential treatment of pediatric acupuncture. So those are two that's where it came out from. It was very interesting, I thought.
That's very interesting.
That you may want to know.
I should mention for those who are not aware of vitiligo, what that is. It's a depigmentation skin disorder. So you get little white patches or are relative to the color of the skin, whiter, depigmented skin lesions. Do you think maybe there's a connection between the name of the point, the white in the name of the point, and the skin condition vitiligo?
I think so. That was a very good observation. I think that has some validity to it. But it also talk about purple vitiligo. Have you ever seen a purple vitiligo?
No,
that's actually what the textbook has actually mentioned.
I haven't. I've seen many cases of vitiligo, but I haven't seen a purple one.
Yeah, there's a discussion in the this classical 寻经考穴篇. They discuss about using lung 3 and lung 4 for this particular condition. And as in the needling technique, we can, when there's a cold condition, we can needle at first to bleed, and then we can tonify by moxa. And if there's a heat, we can just needle directly with the sedation technique. And we can needle 0.5 to 1 cun perpendicularly.
Good. Well, let's look at lung 5.
Lung 5, wow. Lung 5 is an amazing point. I think I can speak for you and I. I think we use this point quite a bit in our clinical practice.
That's true.
Yeah, 指责, it's definitely a beautiful name. 指 means bend. Basically, it denotes to the elbow. 指 means a foot. It's a foot bend. A foot means the measurement. And 指 means a pond or a body of water. Basically, this is where that the channels going through the bend of the elbow, and where there is a collection of qi in this area. I would say this collection of qi is more on the surface, and it's not as deep compared to, say, C-clef point. Later on, we'll discuss. But what do you think?
Well, again, first I'll reiterate that it is one of the more commonly used points, a favorite point of mine maybe. The location of it next to the biceps tendon in a depression which is often palpable as deep is a characteristic of the point. So the long 5 point is located just on the cubital crease next to that tendon, and I tend to needle very close to that tendon for most conditions. And if I needle close to the tendon, the needle will not go very deep. So that's how I would approach that location.
Now, I'm presuming it's lateral to the tendon, right?
Yes, it's lateral to the tendon. Very close, but lateral to the tendon.
Yeah, and I think the action is pretty straightforward here. But before I go into action, isn't this a specialty point of the lung channel? There's quite a few specialty points. Would you want to talk a little bit about that for us?
Do you mean the characteristics of the point, like it's a Hussey point of the lung channel, water point, sedation point? Is that what you mean?
Yes, a Hussey point is... Yeah, and what does it mean by water point of the lung channel?
Well, there's different images that can be used, of course, depending on the model behind the image based upon, for example, the 5N model. The water image can be used as a quality to treat heat conditions, for example, the lung. That would be one approach to say putting water, using water to put out a fire. So sometimes the orientation as a water point means using it to treat heat in the lung. Did you have any other meanings behind water point in mind?
No, I think I would agree with you, and I also agree with you that this is the main sedating point of the lung channel.
Yes.
And so in the sense of action, this really is activates the lung and especially the dispersing, the descending function. It really stimulates the lung to dominate qi and controlling respiration. It's very good in getting rid of lung heat. I think I use almost any time when you have a lung heat issue, especially lung heat cough. I use this point quite a bit, so it does remove the heat in the lung. What other indication would you use it for?
Well, I'll point out the cough too. Any type of excess cough with heat, especially, but a strong cough, basically. Also, a cough if there's any blood in the sputum or blood-tinged sputum would be appropriate. The cough that causes chest pain would be another indication. Of course, then other combinations are emphasized for those different indications. Even with a strong difficulty in breathing, I'm emphasizing the strong because it's a point for an excess dyspnea, excess condition with asthma. Yeah, so those are some of the straight off indications that I would use related to the lung and lung 5.
And I agree with you. I think that especially I want to focus on cough with blood. Now, if there's a cough with some tinges in the blood, not for, say, bleeding or excessive amount of blood, I would use this point. But if we start to get into an emergency situation where the coughing is all blood, I would use more the C cleft point, which we'll discuss a little bit later.
Yes, that makes sense. Well, good. I wanted to mention a couple of unique applications for lung 5 just because I found them to be clinically very relevant. First of all, again, focusing on a point on the lung channel for the meridian or channel and channel pathologies, I really like to use lung 5 for medial knee pain, especially around the area of the pes anserinatus. That's on the medial side of the knee again. And that's a relationship with the foot and hand tie-in. The long hand tie-in treats the spleen tie-in. I'll mention it because I find it to be very effective in addressing painful patterns of the medial knee. The other indication for lung 5 for me is it's one of my very reliable points for a specific type of low back pain, usually around the level of L2 or lumbar region 2, but very specific to a problem of the muscle quadratus lumborum, a very common cause of low back pain. And a third point that is relatively new for me, I had the pleasure to visit a course from Dr. Wang, Ju Yi, I may not be pronouncing the name properly, a genius of a man, a professor of Chinese medicine with more than 50 years experience, probably 55 plus by now, who wrote a book on channel theory and so forth. But one of the comments that he made that I was able to use later in the clinic was the use of lung 5 and spleen 9, both Tai Yin channel points for regulating qi in general, especially when stress is the problem. Now, that orientation usually is one I focus, I've up to that point focused on the liver, but I find clinically this combination to be very effective in moving qi stagnation secondary to stress. And so I use that frequently.
That's very interesting. And now, your own personal experience, I know you treat a lot of these conditions. For example, in what situation, and I know that you're talking about the lower back pain in the L2 level, is there a specific one you would use for with this point? Is it an acute type or is it a chronic type? How do you know that would be the point you would use for this particular
very good question? Basically, differentiating according to the entire pattern. Acute pain, often the most excruciating type of muscular pain, where the patient says, for example, I had to crawl on my hands and knees to get to the bathroom because the pain was so bad, or I couldn't extend my back after differentiating through palpation and a type of orthopedic examination and identifying this muscle. This point usually can make a real significant difference, combined with movement, usually the 1 point, lung 5, and movement of the low back. However, is very important and useful to use in the case of chronic recurrent low back pain, especially with the key indication, the feeling that there's a weakness in the back, a weakness in the low back area. And if the patient were to present with that, I would still needle lung 5 and have the patient move their low back. If there was any pain, I would expect pain relief, but I would also do it even if it was just a question of muscle weakness, and to follow up with local needling if necessary, as well as other local and distal points. But the lung 5 point has been very useful for treating acute and chronic low back pain due to that pathology.
That's excellent. Thank you. That's a great insight. And how about the knee pain? You earlier was talking about you also use this point for the medial perspective, medial aspects of a knee pain. In what situation would you use this point, say, compared to other points or local points of the knee?
Well, usually the use by medial knee pain would be precipitated by an exam where I could identify the problem on the medial knee, not just through palpation, just through testing the function and to recognize dysfunction. Basically translating a spleen channel problem, although this point through channel and cloud theory can also treat a liver channel pathology of the knee as well as a bladder channel pathology of the knee. But I'm finding it most effective by medial knee pain as if it were a spleen channel. So it would be acute pain or chronic recurrent pain where the patient had knee pain as he presented in the clinic. I would needle the point and move the knee if at all practically possible, having the patient walk around with the knee pain, and or if it wasn't possible for whatever the reason might be, the patient would lie on their back. I'd needle the elbow, then I would passively move their knee, or I would engage them in a combination of movements with that knee so that we can see through if by flexing and extending the knee that the pain improves.
And this point is normally needled perpendicularly about 0.5 to 1 cun. And there are some clinicians do not like to use point for moxibustion. They believe because this is a heat purging point with moxa may not work as well. But my professor in Nanjing actually did exactly that. She would actually massage this point for any kind of lung coldness. Yes. And she had find out to be very satisfactory. I thought that's a very interesting take on this point.
Yeah, that is interesting.
Even though, you and I know that in the textbook, it's always been told not to massage this point, always not. In fact, we bleed this point sometimes for excessive heat.
Yes. Bleeding the vein in the area of the point. There is one point I wanted to make to precautions, I'll call it here, and that is if this needle is punctured deeply, it may on occasion reach a branch of the radial nerve, and there may be a radiating sensation down to the hand, to the thumb area or the index finger area. Usually not long lasting, but one needs to be cautious about deep penetration for reasons of not avoiding irritation of the radial nerve.
I agree. And let us jump into lung 6.
Yes.
If you're ready, 孔最.
Yes.
孔最 in Chinese, 孔 means holes. 最 means meaning or most. Since this is a C-cleft point of the lung channel, where the qi gathers very strongly and deeply. And also this is one of the meaning. And the other meaning is interesting, again, a tie-in to the spleen channel. This point actually allows the energy from the qi from the lung channel to permeate through these holes, and is known that this the qi, the channel qi that flows from lung 5 that goes through this point would permeate through these little holes to go moisten the spleen. So is considered a very good point to reach the spleen, especially when there's a spleen dryness condition. You got anything to add to that?
Well, it's a very interesting aspect, of course. A point located in a relatively clear depression based upon the muscular structure fits its orientation as a Xi cleft point, or a point where there's often a little depth in the meridian, so to speak, 7 so and above the wrist. I've used it also for acute coughs, but I haven't approached it for the spleen at this point. That's a good comment.
Yeah, it's true. I mean, in the action, this is very, very similar to lung 5, where it's used to clear heat, but it has a stronger acute function orientation for stop bleeding.
Yes.
It can use to moisten lung and regulate qi. I can see that this is very good, especially when there's febrile diseases, when we really need to clear some of the strong heat situations. And what would you use it clinically for?
I think, as you mentioned, a strong acute cough, and if there's certainly any bleeding or blood in the sputum, a strong cough or a lot of blood, that's been my main approach to using the point.
Yeah, I want to add on to that. It's also used for a lot of infections, a lot of heat-oriented infections, such as fever, headache, bronchitis, pulmonary TB, pneumonia, tonsillitis. And I just want to add on one thing. Interestingly, it's also used for hemorrhoids.
Yes.
And I thought that was very, very interesting. That is used for hemorrhoids. For
heat-type hemorrhoids, do you think? Or excess heat-type, damp heat-type? Or?
Yeah. I think it's for heat-type hemorrhoids.
Maybe with bleeding?
Yeah. I think you got to combine it. I would imagine you would combine points such as bladder 57, Chen Sang. I think that would be a really good combination for hemorrhoids.
Yeah. Very interesting. Good. So the point, would you needle it more than 1 cun deep, or would you need it also 0.5 to 1 cun deep?
I think this point, personally, I think we can needle a little deeper, 0.5 to 1 cun, and all really depends on the patient. Some people are very muscular, so
Yes.
I can imagine we go a little bit deeper. But normally it's about 0.5 to 1 cun, and it's perpendicular, and you can also do it with moxa.
Yes.
Is that how you needle it in your situation?
Usually I'll go a little deeper on this if necessary, as you described it well, based upon the specific anatomy of the patient. I haven't used moxa on this point.
Very interestingly, I know that this point combined with lung 11 South Sang point, I know that is used for sore throat. I wonder if maybe we should try moxa, because I have a feeling moxa sometimes, in situations like heating the point up, but sometimes I wonder it actually draws the heat out. I also, again, that's one of my professors love to do everything contradictory. drives me nuts, because then just like the textbook, you just might as well throw out the textbook. But I do know that needling this point with South Sang lung 11 can be used for sore throat.
Thank you, Dr. Dao.
Thank you for joining us in our discussion of these acupuncture points, and we look forward to visiting with you again in our next episode.
In the meantime, we wish you wellness and health.